Good morning. Today is July 3rd, 2021, Saturday. This is our scheduled Saturday morning yoga therapy class. Today's class is going to be on yoga therapy for functional disorders. It is amazing that in our experience and with our research that for the functional disorders, all the information we know by now, that yoga as a therapy is a wonderful therapy. We call it a dhanantari. Dhanantari is the treatment. Now let me go over with you first before we go for the practice is that first, as you all know what yoga therapy is, but again a lot of new people have joining. Yog and no yoga, we call it yog in Sanskrit. It's a union between your body, mind and spirit. It's a philosophy, 196 sutras called small aphorisms, 193 of them is to quiet down your mind. Practice is called 8 limbs practice. Yam, social restraint, niyam, personal restraint, asana, external, internal alignment, pranayama, prana is a life force, yama is a control and a restraint, it's a voluntary regulated breathing, pratyahara, pratya means reject, ahar means your input, trying to control your 5 senses, input through your 5 senses. Dharan is a focus, focusing on a point, focusing on a visual imagery, focusing on a vibration. 7th is your meditation. It is quieting down your mind, essentially controlling the chattering of your mind. All the thought process you have, you enter in between the thought process, slowly and slowly widens the thought process, makes the thought process wider and wider, and essentially you stay in a very calm, quiet state. Finally, it's called samadhi. It's the union of your body, mind and spirit, and that's all we are trying to enter. But meditation is medication. At the level of meditation, we get all the therapeutic benefits. Next comes the word functional disorder. What is a functional disorder? We call it functional disorders or functional disease. And disease, dis is, D-I-S space E-A-S-E. Before I go to functional disorder, just to let you know, there is a branch of medicine, now it's called a functional medicine. New branch of medicine can come in the precision medicine. That's based on the genetics. We have all pharmacogenetics, drugs based on the genetics, nutrigenomics, your diet based on genomics, precision nutrition. So the functional disease today basically means a group of symptoms of different organ system of which we cannot find the cause with our present day diagnostic abilities. Remember, present day diagnostic abilities. What does it mean? What it means, what we used to think it's a functional disorder before, by the time we find the cause, by the time we could diagnose with our present day diagnostic capabilities, it is no longer a functional disorder. But today, with all these advanced diagnostic techniques, even looking at the cellular level, at the receptor level or the enzymatic level, we do have a lot of functional diseases or functional disorders. Let's start from very common symptoms. Irritable bowel syndrome, IBS, or in fact, in gastrointestinal system. You know, I have a full discussion with my gastroenterologist friend. I do teach a session called Yoga Therapy for Gastrointestinal Diseases. I just tell them very clearly. In a gastrointestinal system, you have basically 3 organic diseases. You have inflammation, like colitis, all the inflammation in the gastrointestinal tract. You have an ulcer, peptic ulcer disease, which you know, and there is a tumor. You have a benign polyp, malignant tumor. So inflammation, ulcer, and a tumor, and rest of the symptoms probably is functional disorders. We try to find all the causes, but we have seen in our practice, you name it, gluten sensitivity, celiac disease, gastroesophageal reflux, your lactose deficiency, all of them, when you get treated, and we'll come to the treatment soon, treated with the yoga therapy, they no longer exist. I personally myself, I have a lactose deficiency, I had irritable bowel syndrome, and because of the type of work I was doing, but after adopting a yogic lifestyle, daily practice of yoga, I no longer have this. So, top in the list of the functional disease is irritable bowel syndrome. Number 2 in the list, fibromyalgia. You talk about fibromyalgia, people do have this definite entity. And we do treat a yoga therapy for fibromyalgia with an excellent outcome. Okay? Then you can talk about chronic pelvic pain. It's a real symptom, chronic pelvic pain, and there is no causation, cause, or diagnostic tools to find the chronic pelvic pain. Interstitial cystitis. Yeah, a lot of people have interstitial cystitis. Even it's documented by cystoscopy. Still called a functional diseases. We can go on and on and on, and even you can say, say migraine headache. We used to call it a functional disorder or functional disease. Now probably, we're still not sure, probably we know at the cellular level what it is. In fact, there is a medication now blocking that cellular, it's called the biological medication. That means it's blocking a, you can say a inflammatory marker, tumor marker, cellular marker, like you may have heard of all these names, interleukin, IL, tumor necrosis factor, TCF, or say insulin-like growth factor. So a lot of things. Anyway, come back. Underlying cause today is called dysautonomia. What is dysautonomia? There is an imbalance in your autonomic nervous system. I want to talk about a little bit more because the people who has a functional diseases, which a few of my friend has, and this is actually a request session from a friend of ours. that the imbalance in the autonomic nervous system. Remember, we have a voluntary nervous system. I can open and close my hand. This is the voluntary. Involuntary nervous system. I'm looking at a food. My stomach started secreting juice, acids, without me trying. Involuntary nervous system. Then I have an autonomic nervous system. My heart is beating when I'm sleeping. I'm breathing when I'm sleeping. My eyes, I'm blinking without me knowing. Autonomic nervous function, which has two components: sympathetic nervous system, which is called fight and flight response, and parasympathetic, which is called calm and digest. Now you're talking. The whole digestive system is supplied by parasympathetic nerve. And what is our experience and our research is that the whole yoga as a therapy. Yoga as a therapy basically means adaptation of the yoga practices based on the patient's clinical condition. And the whole yoga therapy is relaxation response and activation of parasympathetic tone. So we believe that all the functional disorders are due to we call it paroxysmal sympathetic hyperactivity. That means we have a hypersympathetic tone, which is causing fight and flight response, which is not supplying our gastrointestinal tract, which causing high heart rate, high blood pressure, high blood sugar, you name it, and all the gastrointestinal functions. So the therapy today is the balance between your autonomic, sympathetic and parasympathetic nervous system, and primarily the balance of the both sides of the brain. Very important. Balance between both sides of the brain is as simple as it is. You are walking. If your both the feet is not properly grounded with the balancing poses, your two brain functions are not going to work. Your 2 feet, if your body is like a car, both the feet is like your car tires. Steering wheel, the car steering wheel has to be in a balance between both sides. My steering wheel is my eyes. My eyes has to come to a point of a balance between both sides of the brain. And we'll find it out how to do it. Your body in yoga therapy or yogic practice, your right side of the body is a male energy, left side of the body is a female energy. If you're a right side dominant, you'll be using your left side for all day-to-day activities. You'll pick up a glass and drink a glass of water. Exactly, if you're not using your hand, I will be, I can see your hand and I will know whether right-handed or left-handed. Right-handed person is very comfortable, left-handed person will be uncomfortable. Right-handed person shaving, with the electric shaver shaving. The moment he holds the left electric shaver, you won't be able to even able to move the shaver. But if you keep on practicing, phenomena takes place called neuroplasticity, or a habit forming. You will be able to use your left hand, which I've been doing for years and years now. Same as brushing your teeth. I always tell people, try, if you're right-handed, try brushing your teeth with the left hand. Try it, you'll be amazed. You take your brush, try to brush your teeth, and the brush will be all over. Not even close to your teeth or mouth. The moment you bring close to your teeth to brush, you'll see your right hand is doing like this. Because you have an imprinted neuroplasticity. Even if you see a person, see, just give an example. I'm holding a book, holding in the right hand, using my left hand. I'm turning in my left hand. I'm turning my foot with the left hand. I'm very comfortable using the left hand. I can hold into my left hand. I can do my the right hand. I think I'm more comfortable with my right hand because I'm right-handed all my life. But I came to the point that holding my book with the left hand and right hand, I feel equally comfortable. Holding a glass for drinking a water, I feel comfortable. One of my friend, he noticed it. Let me show you what is I'm comfortable to. Here is my mouse and here is my keypad for my computer. Look at that. My mouse is on my left side. I used my mouse with my left hand because I'm right-handed. So one of my friend, he's a good friend of mine, he looked at it and he called me and said, "Yes, sir, I noticed you have a mouse on the left side." I said, "For a reason, for a purpose." And I can tell you today, I feel even uncomfortable now. I'm not saying uncomfortable. If I switch my mouse like here now, using my mouse, I feel a little bit of a uncomfortable, even I'm right-handed. Been doing it for a long time. Same way, when I'm going to type it, I make a point equally on both sides. Both my fingers are moving equally when I'm typing it. So these are day-to-day activities, and the reason I'm saying that we're looking at people are getting better and better by using opposite side of the body. Same way, people may not just sit down on the ground, sit in a chair. But the moment you sit in a chair, I always say keep your spine straight. It will be amazed the moment you keep your spine straight, you develop a fascinating relaxation response. Because your spine normally is going to fall in the front. And here, all the muscles are contracting to keep the spine straight. So if I keep myself straight, this piece of muscle which feels like a stone before, it now feels like a two pillows sitting here. Same way, if I'm sitting down with a cross-legged, this is called Sukhasan, easy pose. After a while, I switch my foot to sit in an opposite cross-legged. Why? I'm trying to activate both sides of my brain. As simple as it is. So, coming back again, or let me show you what I'm talking about. Let me get me a chair. Look at this. This is called your kneeling chair. I will be sitting in this kneeling chair. I'll sit in the kneeling chair. So if I can see, you might not be able to see you properly. Let me show it to you. I will be sitting in a kneeling chair, doing all my computer work, keep my spine straight all the time. And let me try to get another one. I have another chair, a simpler version. Just 1 second. Sorry, I had to go upstairs, but this is a little simpler version, and I'll be sitting here all the time. So instead of a chair, I sit on a kneeling stool. That's my posture. This posture helps me in balancing both sides of the brain, because I'm in a totally relaxed. So we call it a Merudanda Achal. You're keeping your spine straight and using, even if you're sitting in a chair, if you don't have any chair in the chair, and you use your both the feet equally on the grounding posture. And I'll show you standing up that how do you balance in both sides of your feet. Most important is a vision. So let me show it to you what you have to do with the vision, because your vision is your steering wheel for your car. So if you're practicing with me, do this practice. Okay, you have your finger, tip of your finger, and slowly keep looking at the tip of your finger and bring it as close as possible and look at your pupil, where the pupils are. Another way to do it, see if I can do it. You can do a selfie. It's a wonderful way to see the balance of your eyes. Here it is. You are bringing it slowly, maybe touch tip of your nostril. Then you look at the tip of your nostril. You look at tip of your nostril. Take a selfie. Why I'm taking a selfie is that Now what I'm doing, I'm going to go back, take a look at it, take a look at my picture. And I don't know if you'll be able to appreciate this or not, but let me show you my picture. Oh, it's too bright, too light. Okay, this might be. Okay. Now, think about this. The tip of my finger was my left index finger. And if you look at by both the pupil, look at the one on the left side is looking towards little outside than the one on the right side. Do you notice that? So, what I'm trying to tell you, even all the practices I'm doing for years and years, since I was right-handed, I still have a little bit of dysfunction of my both sides of my brain. I wanted to show and prove it to you what will happen to you, why you get a functional diseases, because you have an imbalance in both sides of the brain. In fact, the whole yoga concept has said that your yoga is a health is a balance of your body, mind and spirit. So now what to do? Now you do a practice tratak. Very, very important. We teach everybody with a functional disorder. You practice a tratak. Tratak is your exercise of your eyes. First tratak is same thing. You keep on doing the same thing. Look at the tip of the finger without blinking. Don't blink. Slowly bring the finger in front of you, as close as possible. Keep looking at it, both the pupil. Remember, eyes are supplied by 4 cranial nerves. The main nerve is called optic nerve, which goes straight directly to your brain. So the eyes are called the brain outside your skull. 2 muscles of the eye supplied by the cranial nerve. We used to remember SO4, LR6. Muscle called superior oblique supplied by the 4th cranial nerve. LR6, LR stands for lateral rectus, another muscle of the eyeball supplied by the 6th cranial nerve. Areas of the nerve supplied on the eyes is from the trigeminal nerve, 5th cranial. So 2nd, 4th, 5th, 6th. Out of 12 cranial nerves, 4 nerve supplies your eyes. Next practice we do, I have shown it before also in my daily routine, Dinacharya, is called a Jyoti Tratak. Jyoti means flame. What we do, we'll put a, say, I should have done it, anyway, we put a little flame, little candle. We generally use an oil lamp. We use the oil lamp in the same level my eyes, and I sit down in a very meditative posture with the spine straight, with my mind quiet down, but my eyes open. Eyes open, I look at the flame of the oil lamp without blinking my eyes. Remember, blinking is both voluntary and involuntary. Blinking is like your breathing. Your breathing is both voluntary and involuntary. Jyoti Tratak. Jyoti is a flame. Tratak is looking at the flame without blinking your eyes. 30 seconds, minute and a half, 2 minutes. You will have started having water coming out from your eyes. Remember, when you have a parasympathetic activation, see, I have a saliva in my mouth because the parotid gland saliva comes from is supplied by your parasympathetic nerve. Same as your eyes. The water coming from the eyes called a lacrimal gland supplied by parasympathetic nerve. You have a parasympathetic activation, dryness of your eyes goes away. Functional disorders, dryness of the eyes, irritation of the eyes, redness of the eyes, lot of symptoms in the eyes are also due to functional diseases. Next, you exercise your eyes with a tratak in different positions. Best way is to have both the thumb outside. Let's see. So, don't blink it and don't move your neck. Look to the left thumb, look to the right. Look to the left, look to the right. In fact, sometimes look to the left, stay there and keep doing your breathing. Breathing out longer than breathing in. Look to the right, to the same thing. When you practice at home, do it, and if you're doing it with me, try it. Shift your hand right up, left down. So look, right up, left down. Right up, left down. Right up, left down. Shift in the opposite direction. Left up, right down. Left up, right down. Left up, right down. Hands on both sides. Now to look high up and then down. High up, then down. Up and down. Now you rotate. Up, left, bottom, right. Up, left, bottom, right. Up, left, bottom, right. Up, left, bottom, right. Then up, right, bottom, left. Up, right, bottom, left. Up, right, bottom, left. You can continue this. You'll be amazed the moment you will be able to do this daily practice. This is the steering wheel of your mind, steering wheel of your brain. You will have an amazing relaxation response, amazing balance of both sides of the brain. Same way here, sitting down. What do you do next? Keep your spine straight and quiet down your mind. What is mind? Mind in yoga called content of your five senses. I see, I hear, I smell, I taste and touch. And the biggest input through five senses is my vision. So I close my eyes. I touch my index finger and thumb. This is called a hand gesture or mudra. Put it over my knees and quiets down my mind. Use my breath. I breathe out first. Slowly take a deep breath in. Breathe out longer than breathing in. Deep breath in. Breathe out longer than breathing in. Breathing out is parasympathetic. Breathing in is sympathetic. Easily you can take one heel to the back, take your other foot in the top, your knee drops down. If you're in the chair, sitting in a chair, you also can raise your one foot on the top of the other and see how you feel. I feel very comfortable. Then see, I have a saliva in my mouth. I've been talking to you for 45 minutes. I don't need a glass of water. When does your mouth get dry? Your mouth gets dry when you have a fear, when you have a stress, when you have a sympathetic response. You get a dry mouth, but I have a wet mouth. So I'll do the same thing. I take it to the right heel, put the other foot here, it drops down. If you let it be here, it will go down on its own on your practice, what is called neuroplasticity. I'm sitting here because both of my brain allows me to sit like this. From here, remember, I'm doing all the balancing. I'm putting my one foot in the top. This is called half lotus or your swastika asana. Your whole body gets relaxed and the hand gets relaxed. When you do this is called a Balu Mushti Mudra. Take your thumb inside, put your hand here, your hand will get relaxed. If you can separate your toes gets relaxed. Put your hand slowly through your toes. Initially it's very difficult. When you do it, peripheral neuropathy goes away. Another thing, peripheral neuropathy, we think today it's a ischemia, that means low blood supply to the nerve itself. Medical term, we call it a vasa vasorum. Vasa vasorum means a small blood vessel supplying the nerves which is taking your sensation to my brain back and bringing it back. Same way, I'm doing the opposite side. Balancing pranayama, alternate nostril breathing, Anulom Vilom pranayama is ideal to activate both sides of your brain. Because you will see on your own self-assessment, both sides of your nostril are never open equally. One side is always more open than the other. Let me try. Closing my right nostril, I'm doing little Kapalbhati pranayama with my left nostril. And if you're practicing with me, try. It's a fascinating way to find it out. Or in a mirror, you can be able to see which side of the nostril Ella is moving. Do the opposite side. Definitely, my right side is more open than my left side. And I can tell you and I can demonstrate to you, if I start doing alternate nostril breathing, or maybe before I do a bumblebee breathing, Bhramri Pranayama. Bhramri Pranayama shuts down my senses and it creates a frequency which is the same frequency of the brain. My both nostril will open up better and better. Left nostril is called Ida, right one called Pingala. That always an imbalance. Left nostril is parasympathetic, right nostril is sympathetic. When both of them opens up, it opens up a central channel called Shishun Manari. See, I'm comfortable. Let me put down other foot here. And then let me do a set of Bhramri Pranayama, bumblebee breathing. If you're practicing with me, let's do it. You have done it with me before, a lot of times. It's a beautiful practice. See, we're using the same practices, but yoga therapy is learning how to pick and choose. You have the same tools in your bucket. You're picking up the tools to use it based on the patient's clinical condition. People all the time ask me, yes, every yoga practice is therapeutic. Keep on doing a daily practice or a routine practice of yoga, you will definitely have a health benefit. But able to learn how to pick and choose for what clinical condition is yoga therapy. That is the reason regular yoga teachers training course is about 200 hours. And yoga therapy training is 800 hours, 1000 hours, 1500 hours. There's a reason for it. So, index finger in between your eyebrows, close your eyes between three eyes. Also, you can do another mudra, called Shanmukhi mudra. Put your thumb in the ear to close your ears, close your mouth. You always breathe through your nose, breathe out through your nostril. You will take a deep breath in through the nostril and breathe out with the sound of a bumblebee. Use your palming and cupping. Keep rubbing your hands. Keep rubbing your hands and you feel the warmth in your hand. If you're wearing your glasses, remove your glasses and take both the hands, put it over your eyes. Let the eyes take the heat from your hand. Massage your forehead, massage your eyes, massage your face, massage your ear, behind your ear, in front of your ear, inside the ear canal. This is called the auricular branch of vagus nerve. It activates your vagus nerve, and vagus nerve, remember, 80% is the afferent. Takes the signal inside the brain, 20% is the efferent. Bring the hand down, massage the side of the neck. This is called carotid sinuses. When you do massage the carotid sinuses, you activate the vagus nerve. Take the hand to the back, massage at the middle. These are called insertion of the two muscles, called sternocleidomastoid muscle and trapezius muscle. Both are supplied by your cranial nerves. You can feel a sense of relaxation in your whole body and mind, and it is a very simple practice, and you keep doing it. Practice your eye for the tratak. Practice equally using both side of your brain. When you walk, put the right foot first, then the left, right and left. I've seen people walking right to the right to the right. No, right, left, right, left. Getting up to the steps. Right foot, one step, left foot, another step. Right foot, left foot. Even coming down. If you have a problem with the knees, hold on to a handrail. Right foot first, then the left foot. Right foot, left foot. Built into your daily lifestyle. See, that's very simple. I always show it to you. I'm in a state now. I can put my feet high up. I can sit down in a lotus pose with a profound level of comfort. But if you're not prepared, you'll feel uncomfortable. Next thing you're going to do, oh my God, I'm doing it. I'm doing it. But you listen to your body's signal. You listen to your body's signal, there will be no pain, effortless breathing. So as simple, I can always get up. I put myself in a lotus position, but I'm going in sequence. Also, wonderful relaxation is your squatting pose. If you're able to sit in a squatting pose, ankle is relaxed, knee is relaxed, hip is relaxed, back is relaxed, hands together, separate your hands. When your hand is relaxed, your hands are all separated. Wrist gets relaxed, put your one elbow inside, other elbow inside, slowly bring both the hands close to you. Keep your spine straight. Keep looking, then close your eyes. Breathe out longer than breathing in. This is a wonderful, wonderful balancing practice from yogic standpoint, because it is a profound relaxation response. This is the activation of parasympathetic tone. Same thing happens, a prayer pose to the back. Same thing happens when you relax your neck. Same thing happens when you do a prayer pose to the back, neck relaxation, and using bumblebee breathing at the same time. I've shown it multiple times. You can sit down in a chair and practice. Next one. The profound relaxation is able to get up from here without any support. So, getting up without any support. You need to practice that. So, I always hear, I could do it. I can do it. I used to do it. I said, great. So why don't you do it now as a daily practice in your lifestyle? Okay? I'm comfortable standing like this. That's where we stand. We always stand with a stand. People will tell you, yes, yes, put your feet at the side of your shoulder. This is called your mountain pose or your stick. We call it a Jashthyasana. Your ear, your shoulder, hips, ankle in the same line. So this practice, we do it all the time. Every single day I do it myself. But this is a pick and choose. Pick and choose you do. You know, my body is flexible enough. I can do all this stuff. I can move my hips. You know, it's a wonderful. We call it an emancipation. Remember before, if I need to get up something, I have to think 3 times how to go down. But today, I need to pick up something. Picking it up. Balance yourself. Put your feet together. Going against the grain of your habit is your balance. Ayurveda, we call it the sister science of yoga, but Ayurveda and yoga derives from the same. Ayurveda always says law of balance. Ayurveda says the law of attraction. Whatever is your body type, psychophysical body type, you get attracted to the qualities. Then you check your balance. Standing like this. Beautiful. I feel very comfortable. Cross your feet. Cross your feet. See if you can sit down. Crossing your feet down. And get up. Crossing your feet up. See, we learn from our experience. Pick and choose. These are the ones which are for your functional disease. People with fibromyalgia, we tell them to do this all the time. People with fibromyalgia, see, we'll let them do it standing on 1 foot. I'm going to show it to you next. Balancing poses are the first and foremost practice we do for fibromyalgia. Then we do bumblebee breathing, Bhramari Pranayama, then alternate nostril breathing. And in a meditative state, what we do a alternate nostril breathing without closing our nostril. Here it is. I turn my foot in the opposite direction now. Other side. Now with the other side, I can sit down. I can get up without a support. Then you go all the way. Sit all the way down to the ground. Your feet are crossed, all the way down to the ground. From here, you get up without a support. You talk about irritable bowel. I had a serious irritable bowel. I had an open heart surgery. I had multiple medical issues. Overcame everything, but these are my daily practices. Sit down again, crossing the opposite side. So if you use your one hand getting up, you lose 25% of your balancing health. If you use 2 feet, you lose 50%. If you do 2 hands and a feet, you lose 75%. From here, you get up without support. Once you get up, what you do, remember, when you fall down, you always fall down in your hand. When you fall in your hand, outstretched hand, what happens? You have a fracture. It's called a Colles fracture. Classic. It's called fracture in the radius and the ulna. It's called a Colles fracture. And even people teach you, especially the elderly person, the number 1 cause of death is the fall. They'll teach you how to fall on your side, not on the hand. So, if you take out your hand function, so you can do a called prayer pose to the back. Take your hands, slowly turn it around in a prayer pose. Keep your hands here. Be comfortable. I'm right-handed, right-footed. I have seen with my eyes. My brain has still not been completely balanced because I've been practicing with my right side all my life. I almost do everything with my left hand except the writing. Still the right, I cannot. So stand on your left foot. Stand on your left foot and keep counting how long you can stand. 10 seconds, 20 seconds, 30 seconds, 40 seconds. Then you can close your eyes if you can stand without closing your eyes. Initially it will be almost impossible, but it is a wonderful balancing practice. My friends called me and said, you know, you told us to do it, I've started doing it, I can hardly do 4 seconds. I said, great. He said, why? I said, still you can do it? You still you can start? You can start it. He said, what do you mean? I said, keep on doing it. Soon you'll be doing 10 seconds. Soon you'll be doing 20 seconds. Soon you'll be doing 30 seconds. Same way, right side. My hands are all in the back. In the prayer pose to the back. Standing on the right foot. If you really initially start, focus on a point. Focus on a line. It gives you a lot better perspective. Then close your eyes if you can do it. Closing your eyes if you can do it. I tell you, initially it's not that easy. Not easy. So what you need to do, maybe you go behind a chair, or sometimes I do it. Here is my treadmill, here is my benches, I do all of that stuff. I will do it holding here, closing my eyes, and then slowly I will let go. Maybe I can balance myself. Either way, any way you start, you'll be able to do it. A powerful relaxation is your Kapalbhati Pranayama, breath of fire. We don't want you to do any pranayama standing up because standing up, pranayama causes an altered sense of consciousness. So pranayama practice we ask you to do sitting down, maybe laying down, sitting in a chair. But I will show you a Kapalbhati Pranayama as a relaxation response and to the maximum effect of your balance. So my hand is to the back and you'll see these are people called challenging poses. These are not challenging poses. It comes to you. Then you can do a Vrikshasana, tree pose. Feet here below the knee, you can put it above the knee. You will try putting in a tree pose, try to put your hands in front, hands high up, and you can put your hands in the back. You will see the difference. You will see what difference it makes, hands in the back. From here, you are going to practice a Kapalbhati Pranayama, but not for the pranayama's sake, just for the relaxation's sake. You can do the other side. And again, remember how many times, how long, all based on you when you started it. Everything you do yoga as a therapy is based on your body's perception. no pain, essentially an effortless breathing. You can do any kind of asana, doesn't matter. You can do your Sukhasan, headstand, you can do your Sarvangasana, shoulder stand. Always remember, balance on both sides. I've shown you multiple times. I will do a shoulder stand, I'll do a shoulder stand, then I will do a lotus pose, but I'll do both sides. I will do lotus pose, Padmasana, I will do equally on both sides. So maybe I can show you one time. Maybe you like to see, probably all of you have seen this stuff before, but just to show you what I'm talking about. Here you can go to a shoulder stand. From shoulder stand, you can do eagle pose. Wrap around your leg, equally on both sides. Right side and the left side. You're doing a lotus pose on a shoulder stand. You can do the same thing on the other side. You will bring your other foot high up, both sides. You also stay on the poses. You don't get in and out of the poses much. Finally, after all this, the best balancing practice will be your alternate nostril breathing, called Anulom Vilom Pranayama, and then a meditative pranayama practice, which is alternate nostril breathing without closing a nostril. Let's do the practice before we finish. Use your left hand, use a mudra called your Dhanu Mudra or a Canon Mudra. Put it over your left knee. Right hand, close your right nostril, not all the way down, just underneath below, very lightly. Breathe out first through your left nostril. Take a deep breath in through your left nostril. Drop your hand down, close your left nostril with the ring finger and little finger, and breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril, breathe out through your left nostril. If you're practicing with me, keep doing alternate nostril breathing. Slowly close your eyes and do the alternate nostril breathing, closing your eyes. Left nostril is controlled by the right brain. Right brain is intuitive, right brain is female, right brain is cooling, right brain is parasympathetic. Left nostril breathing is parasympathetic. Cooling is called Chandra Nari, moon energy, Ida Nari, and also is called Chandra Bhedi Pranayama. Chandra is the moon, moon-centered pranayama. Right nostril is controlled by your left brain. Left brain is heating. Left brain is analytical. Left brain is male. Left brain is sympathetic. Right nostril breathing is called heating. Right nostril is sympathetic. Right nostril is Pingala. And it's a sun energy, or called Surya Vedi Pranayama. Sun-centered pranayama. Slowly take your index finger and middle finger, put it in your third eye. Take your left hand, hold on to your right earlobe. This is a balancing pranayama. Keep doing alternate nostril breathing. How long to do it? Initially you do as long as you can do without any effort in your breathing. Effort in your breathing means you can talk, you can even sing when you are doing it. And if you keep on doing it like we do it all the time, for us, we do it between 5 to 10 minutes. Daily practice, we try to do it 1 hour, 25 minutes of asanas, 25 minutes pranayamas, and 10 minutes of meditation. You can keep on doing it. It really balances both sides of your brain, but for politically correct and so-called critical thinking people, we said you also can do it your other hand, left hand. You can do the left hand, same way, put your index finger, middle finger, do that and hold your left earlobe with the right hand and keep doing alternate nostril breathing. You know, when you do this with your eyes closed, you are totally in a transcendental state. Your body moves, you turn around, you do like this without knowing. You have no idea you've been doing it. Remember, our physical body is a hardware, mind is a software. Fix your software, hardware will be fixed. Let's finish with so-called almost impossible practice, but it became possible. In yoga it says, in stages, impossible become possible. You will touch your index finger and thumb. This is called Canon Mudra, Mudra. You'll be putting over both the knees. You'll be closing your eyes and you will bring your awareness to your both the nostrils. You will do it silently, but since I'm guiding you, I'm going to tell you how to do it. Then we'll all do it silently for a short time. Visualize, bring your awareness in the left nostril. Visualize you're breathing out through your left nostril. Visualize you are breathing in through your left nostril. Visualize you breathing out through your right nostril. Visualize you are breathing in through your right nostril. Visualize you are breathing out through your left nostril. Now, with silently keeping your spine straight, eyes closed, keep doing alternate nostril breathing without closing your nostril. This is the way you transcend from a gross body to subtle body, from sthula sharir to sukha sharir. I can tell you, I can clearly see I'm breathing through one nostril, breathing out through the other nostril. You will feel that all the muscles are relaxing down. You will feel the sensation when you're touching the fingers are going down. You will feel a capillary pulsation. You can feel the pulsation in the tip of your fingers. So wonderful practice. Slowly bring your hands in front of your heart chakra. Touch your little finger and thumb. Separate your ring finger, middle finger and index finger. Padma Mudra. It connects your body, mind and spirit. Heart is the side of your soul. Slowly bring the mudra to your heart. Remember, we always say memorize by heart. All of your life ends in your emotions called bhavanas, called rashas. When you look at your hand, which is a mudra, jatha hasta tatha drishti, means wherever your hand goes, your eye follows. Jatha drishti tatha mana. Whatever comes through your eyes, it goes to your brain or goes to your mind. Jatha mana tatha bhavana. Whatever your mind, that is your emotions. Site of your emotion is your heart. Jatha bhavana tatha rashas. There is a 9 rashas called 9 emotions in our philosophy. So when all the emotions are under control, mind is under control, software bugs are gone. All the functional disorders in your body slowly and slowly goes away. Bring your hand close to your heart chakra. Rub your hand. Keep rubbing your hand. It's a wonderful practice to finish your session. You feel the warmth in your hand. If you're wearing glasses, remove your glasses. Put your hands over your eyes. Massage your forehead. Massage your eyes. Massage your face. Massage your ear, behind the ear, front of the ear, inside the ear. Slowly bring it down. Massage in front of your neck, the carotid sinuses. Massage to the back, the insertion of trapezius and sternomastoid muscle. And finish wonderful practice. I can tell you from our personal experiences and our research is that in Western term we can say money back guarantee. If you have a functional disorder, including gastroesophageal reflux disease, irritable bowel syndrome, any kind of gastrointestinal symptoms, starting from lactose deficiency, gluten insensitivity, celiac disease, all the causes we know of gastrointestinal disorder. I can tell you, if you can exclude an inflammation, ulcer and a tumor, these symptoms will correct undoubtedly with a parasympathetic activation. This whole gastrointestinal symptom system is supplied by parasympathetic nerve, and we do not have a parasympathetic tone enough. I can go all, our body is a call it a default mode network. People say, I'm wearing these glasses, I feel so uncomfortable. So fine, take off your glass. Try reading a smaller print. Try looking at a blurry object. Your eyes will try to correct your vision on its own. No, I see so good. Fine, wear glasses, don't complain. Take pills. All the doctors who comes to my classes, you know what they come for? Failure of the pharmaceutical support, side effects of pharmaceutical support. Thank you again. Next Saturday, I'm going to teach a yoga teachers training course, and as a part of the course, we'll do this Saturday morning session, and session probably will be an introduction to the yoga therapy, because I want all the yoga teachers in the yoga teachers training to have a practice session of yoga therapy. Thank you for joining. And again, this is my left hand. See that? I'm finishing using my mouse with my left hand. Balancing both sides of the brain.